How many discounts does USAA Auto Insurance offer? Too many to say here. Multi-vehicle discount, safe driver discount, new vehicle discount, storage discount, legacy.
How many discounts will you stack up? Visit USAA.com/auto discounts. Restrictions apply.
Hilton brings you new ways to stay, with experiences that let you capture the glory days. Introducing the Graduate Hotels. Each inspired by local college towns, these stays are always original and never boring. Get in touch with traditions all across the country and enjoy a stay that's a class above the rest. Book at Graduate Hotels with Hilton Honors Points at Hilton.com. It's a win-win. Hilton, for the stay.
The Dental Download podcast is your source for insight from conversations with fellow dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Dr. Haley. Let's get into this week's episode. All right. Hello, everyone. So we have a guest here today. Would you be able to introduce yourself a bit and tell us about your background in dentistry?
Sure. My name is Dr. Effie Habsha. I am a prosthodontist. I practice in Toronto, Midtown Toronto. I've been practicing for quite a few years, and my practice is limited to prosthodontics and implant dentistry. It's a referral-based practice with I place my implants and follow a fully digital workflow. So it's a really fun place to work. I'm also resident faculty at Spear Education, which is really exciting. I joined the team last year, and I go down there quite a bit during the year. And finally, I'm the founder of Women in Dentistry, which is a group that we founded 15 years ago, really with the mission to educate, elevate, empower all women in the dental field. So we have events throughout the year in Canada and soon to be in the US, and a huge online platform. So that's what I do professionally. Personally, I'm a mom. I have 4 kids, a daughter and 3 sons. So my life is very busy at home as well. So it's a great combination of, work and family and all the stuff in between.
I love everything you just shared with us. We're going to kind of unpack it piece by piece, the different elements of your life professionally, and also talk a little bit about, being a woman in dentistry and what that looks like for you, as well as your involvement with that when it comes to Spear. So right off the bat, you mentioned your family. So why don't we just get right into how you personally like to manage everything you have going on in your life, professionally and personally?
I think that's a very good question. I often get asked that because I have so many children in relative terms. I think that the answer to that is I just different times in my life were crazier than others. Right now, my children are pretty much grown. My baby is 17 years old. So the kids my eldest is 23, and my sons are 20, twins, and then my youngest is 17. So they don't need a lot of hands-on now. So I'm able to, for example, travel as much as I do now, because I do go down to Spear, to Scottsdale quite often, and other, teaching engagements. So balancing that now is much easier than it was in the past. With younger children, we had kind of, a village. For me, a live-in caregiver was what worked. And so that's how I was able to kind of really manage and maintain a thriving professional career while still being a very hands-on mom. So that's what worked for me, and continues to.
So you really lived all of the different stages of everything now that your kids are grown. Yeah. What throughout that time kind of prompted you to want to develop the Spear Women in Dentistry kind of program?
So I think really it started off as Women in Dentistry. Spear came on later, which just recently last year. But, I'd like to think of it as I wear multiple hats. So one is my, Dr. Effie Habsha, the clinical, my day-to-day busy prosthodontic practice. The other is like an international speaker. So that's where all of my commitments with SPEAR and other educational opportunities come up. And I'm very blessed to be part of educating dentists in Canada, the US, and elsewhere. And then the third hat professionally is women in dentistry. So managing all of those is what keeps me busy professionally. And then, we can talk about the personal life later, but really, to answer your question in a nutshell, we founded Women in Dentistry 15 years ago with the intent of really just connecting locally with my local female referrals. And that has since snowballed into pretty much an international movement. And the relationship with SPEAR was just kind of a natural partnership. I mean, really, I wore my Dr. Effie Habsha hat for SPEAR, so I don't really do much in terms of women in dentistry with SPEAR education, with the exception of launching a joint event that we're doing for the first time with SPEAR education and women in dentistry this September. So beyond that, this is the first of possibly more retreats to come, but we can certainly talk about that later or now if you want, but that's been the connection between SPEAR and women in dentistry. But besides that, I just go down and do what every regular dentist that teaches there does, workshops, seminars, and being part of the SPEAR faculty, which has been really, really wonderful.
Interesting. I didn't realize that connection was so recent between kind of your two different elements of your lecturing and then the women in dentistry. So you said you started it 15 years ago and it's kind of snowballed and grown internationally. What point did it start to reach outside of your Toronto area where you're based? Was it because of like online presence, Facebook groups? How did it all work?
Yeah, that's a really good question. I think, the expression with every cloud, there's a silver lining. So the silver lining for COVID for me was women in dentistry. I mean, there are other positive things that came out of the pandemic, but one of them was the ability to branch out internationally and really giving exposure to the group. Prior to then, I would say 8 years into women in dentistry. For the first 6 to 7 years, I was more local. And then because the community here was so eager to have more events, we expanded. But really hitting that international mark has been about 5 years since the pandemic with online presence and interest in other groups. So it's just really been an organic growth. And now we have people kind of interested in other parts of Canada and the US to work with us and develop almost sort of satellite versions of this community. So we just are expanding very organically, which has been really cool.
That's wonderful. And looking back to the years when your kids were younger and I know you said you had a lot of help, but how did you manage scheduling out time for family, travel, CE, your clinical work? Did some things just have to take the back burner and that's what you have more time now to do?
Yeah, pretty much. I mean, if you would have spoken to me, I would say, when my youngest, who's now 17, reached like school age, so like the age of 7, not school age, I mean, he went to school before then, but when he was a little bit more independent, so coming up to about 10 years, I allowed myself to, travel a little bit more. Prior to then, I pretty much stayed very local. I, didn't venture that much out of my my city. So, my advice to younger clinicians is like, it's okay if you're not doing it now. It doesn't mean that things will stay the same. I mean, for me, it's just been very organic, the growth. So I allowed myself to have the time with my kids when they were younger, really only work 3 days a week and just wear my mom hat full time 2 days a week, which was, in addition to the weekend. So I had 4 days with kids, 3 with work. So that mom guilt didn't really sink in. And as they got older, I was afforded more time to be able to kind of venture out. In terms of CE, I never really brought my kids to CE because it really wouldn't be fun. Like for me, work is work, vacation is vacation. So the typical, school holidays, I shut down over Christmas. I like to take the full 2 weeks off and really focus on family time then. And then at other periods, in the summer or whatnot. But for me, education, I wear my education hat, and personal, fun trips are kind of separate. So that's how it's worked for me.
Nice. And within the women in dentistry community, it doesn't even have to be specifically your own story, but what are some of the kind of present challenges that you're seeing people dealing with and discussing the most, and how the community is benefiting them?
Yeah, I think it's just a community where, like-minded or people in the same circumstance are coming together. So, issues that relate to the female clinician or the female professional that may not pertain to the male professional are some of the things that come up. So, the obvious one, maternity leave and having young kids. I mean, despite the fact that, dads and men are obviously a very integral part of that, but often from my experience and from, most of the women that I work with, the heavy lifting of kind of running the household and childcare and whatnot often lies with the women. And so it's kind of a nice forum to, have conversations about kids, mat leave, practice ownership, associateship versus owning your practice, whether to work in a DSO. So those sorts of natural type of conversations come up. But then we've had some specific workshops geared towards the female professionals. So things like, financial knowledge and financial help, and items related to health and wellness and leadership skills and communication, which are, believe it or not, can be very gender specific. And so having that available to the community has been really wonderful. And beyond that, of course, just the regular run-of-the-mill general dentistry. Sometimes, particularly I found with our newer grads, because we do a lot of work at the University of Toronto, there could sometimes be a bit of an intimidation factor when, for CE with younger female professionals, might be a little bit more intimidating to be part of kind of an all-male or predominantly male crowd. So we found that this is a little bit more of a less intimidating form where we have speakers that could be a little bit more relatable and less intimidating to certain, younger clinicians.
That's wonderful. And you were touching a little bit earlier about how now you're collaborating with Spear for a retreat. Tell us some more about that.
Yeah, so I think Spear Education, they've always been at the forefront, I think, of, providing really excellent dental education. If you look at, from the resident faculty, obviously originating with Frank Spear, and then beyond that, they've always had their finger on the pulse of what works for education. And I think what, part of that is just being open and seeing the movement that there is a need to kind of, or a desire to have these retreats. And I know that there's a very successful orthodontic group, like a Women in Orthodontics group that one of my colleagues, Dr. Tracy Hendler, is a member of. And it's just a great way to connect in order to learn. Obviously, the most important thing is it is a clinical, scientific CE credits type of event. But beyond that, delving into the other items or other topics that I talked to you about. So Spear kind of recognized that demographic, which may benefit from a collaboration like this. And rather than reinventing the wheel, we thought, well, let's work together, because I'm already on faculty, so why not? And put something together that's really fun. And what better place to go than Scottsdale, Arizona for a girls' trip? So registration has been wonderful so far, and we're looking to sell out, but it's really a quick kind of getaway 2 days or a day and a half of lecture with really great speakers that's geared towards the female professionals. So I'm really proud to be part of that collab with Spear Education, and I really commend them for recognizing the need and actually doing something about it.
Yeah, I was looking at the itinerary and the courses
Great,
and
isn't it?
everything that would be offered. It looks awesome. So I definitely encourage people to
Yeah.
check it out and try to get a place if there are still ones by the time this
Oh
goes
yeah,
up.
there's still spots available. We're only
Yes,
in we're still a few months out, so it's in
yes.
September 19th and 20th.
Beautiful. So transitioning a little bit back to your clinical practice,
Yeah.
what sparked your interest in prosthodontics and what was your process like for pursuing a specialty program?
Yeah, I think it's a very good question. I think, like a lot of young dentists, actually, my son just got into dental school, so it's very fresh for me. You go into dental school and you kind of don't really know anything about anything, especially if you come from a family that not don't come from a family of dentists. So, which I didn't, and kind of really gravitating towards a discipline that appeals to you. For me, it was pros from the beginning. I liked the art and the science. I liked being creative. I liked, providing patients with often elective care, which was nice because patients come to my office because they want to be there, not because they have to. And so it sparked an interest in me. I worked in the pros department as a dental student, and that was kind of what turned me on to the discipline. And then for me, I like to do things kind of, I have a very specific focus, and I knew like this is what I want. So I pursued my postgraduate, my graduate education in prosthodontics right after dental school. So I did a 1-year residency, which I highly recommend to anyone, a hospital-based residency for 1 year. And then following that, my prosthodontics training at the University of Toronto. So that was my path. I wanted to go in straight from dental school. I
And
haven't
you
looked back.
Yeah, that's
Yeah.
wonderful that you figured out your interests early by kind of just
Yeah.
putting it all out there in dental school and trying to figure out what you truly
Yeah.
liked and
Yeah,
just kind of going for it after
for
that.
sure. Yeah.
And over time, obviously, digital dentistry has become almost hard to not utilize these
Yeah.
days. And you mentioned it's such an important part of your workflow and something you
Yes.
really enjoy about your day to day. Tell us more about what you enjoy about digital dentistry and how it impacts your practice.
I think it's a really good question. I think it's multifactorial. There are so many benefits for me. I'm really fortunate to work in a multidisciplinary practice. The principal owner of the practice, Dr. Barzilay, was very keen on kind of being at the top of technology and bringing those relationships into our practice with providers that were able to offer digital solutions. So we actually had our first scanner back in 2010, and I won't mention any names, but it didn't do what we wanted it to do. So I kind of used it for a bit and then put it aside because I wasn't able to do comprehensive care. As a prosthodontist, I do full mouth rehabs. I'm not doing one unit at a time. And so there was a bit of a void and a lag in what I needed from a digital workflow until I incorporated around 2013. Back then, it was the True Definition scanner by 3M, and then that evolved for me using 3Shape scanner. And I've been really converted 100% digitally in every aspect of my workflow, from diagnostics using Smile Design with a particular software program that I use now called Smile Cloud to get my initial diagnostics. Our radiography, CBCT is all in-house. And then working our way, for me, as I said, I place my own implants. So using a digital workflow to do that, planning all my cases, in co-diagnostics, placing my implants in a guided fashion has been, really part of my workflow for the past 10 years. And then beyond that, all the prosthodontic work. So from a single unit to full mouth rehabilitation on either single crown or full arch implant restorations, it's all been fully digital. And the benefits are really tremendous for the patient. I think it's a lot more comfortable. You can do a lot more efficient training, a lot more efficient dentistry. Certainly for the staff, it part of making them really feel part of the team because they do a lot of the diagnostics, a lot of the scanning for us. And for the practice workflow, I mean, I'm a lot more efficient, so my productivity has increased. And so I kind of practice what I preach, and I do lecture quite a bit on digital dentistry and how it can enhance your practice, and I experience it every day in my practice.
This episode is brought to you by Indeed. When your computer breaks, you don't wait for it to magically start working again. You fix the problem. So why wait to hire the people your company desperately needs? Use Indeed's sponsored jobs to hire top talent fast. And even better, you only pay for results. There's no need to wait. Speed up your hiring with a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Are your business expenses playing hide and seek? With Uber for Business, the small spends that slip through the cracks, like rides and meals, go right where you need them. Because it integrates with leading expense platforms, you can say goodbye to surprise costs, missing dollars, or chasing receipts. Everything's track downable. Uber for Business. Make small steps that make a big impact. Learn more at uber.com/small steps.
So another thing you mentioned a bit there, I'd love to hear you expand a little bit more on how your auxiliary team is utilizing digital dentistry and how you find it improves, collaboration aspects, probably their job satisfaction because it's fun, it's more engaging.
Mm-hmm. Yeah, I mean, I can't do anything without my team members, as most dentists would agree to that. So my team, or I work with 2 assistants at all times, and they're just wonderful. They're my right-hand people. And so they were trained on all of the digital workflow. So from diagnostics, they take my digital photography, so pre-treatment photographs, in treatment, post-treatment. They upload my content into the SmileCloud software. They are an integral part of my day-to-day prosthodontic scanning. So any intraoral scan, they will do all the pre-prep scans for me. So I always run 2 rooms at a time. So one assistant could be doing the preliminary scanning for a patient while I'm working, and then we kind of move from room to room. And I find what's really nice about it, beyond the benefits for me and for the practice and for the patient, it really makes the assistants feel very empowered, because it's something that they get very good at and something that they do well, and they take real pride in it. And then as new staff come in, they're training them to, how to utilize the technology. So I think it's a great kind of team builder, if that makes any sense, or it really, I really appreciate their knowledge and their skill set to be able to do that.
Yeah, I definitely relate to everything you're saying. Yeah. It's incredible the impact it has on the team and the abilities that they're able to do when you're not in the room, and going over cases later when you have all those great digital records. It's very, very impactful. You were mentioning earlier that your practice structure is kind of multidisciplinary. Yeah. Can you tell us a little bit more about what that looks like?
Absolutely. When I joined back in 98, it was a one-man show. So the principal owner was the only clinician, and I joined, and we had to build an op for me because he only had 1.5 operatories. And we kind of grew from there. And now we have 10 clinicians, a staff of over 30. We have several prosthodontists. We have a few periodontists, an endodontist, an oral surgeon. And it's a really great place to work because the patients come in for a one-stop shop. I mean, they could be pros only, but if they do want to have treatment from start to finish, if I can't do the surgical aspect, I have my surgical colleagues to be able to offer that solution to the patient. And so besides the practicality for the patient and the logistic benefit, it's really great not working alone. I'm a people person. I love to have people around me. I love to have colleagues around me. We love to discuss cases formally and informally. And it's a really great practice model, which I'm really proud to be part of. So that's what worked for me over the years.
That sounds amazing. So is it just a giant facility and it's
Yeah.
all of you working kind
Yeah.
of hand in hand with the
10,000 square feet or so. I don't know if
wow.
metrics used in the US, but yeah, so it's a pretty big facility in Midtown Toronto. And it's a great place to come to work. I mean, we spend so much time at work that, if there's any young professional listening to this, follow your heart in terms of joining a practice that speaks to you, and people that have the same philosophy. When I was looking for a job, coming out of grad school, I had several opportunities, but I joined this practice even though there wasn't much to offer. Like I said, we had to build an op, and I really built my practice and my patients, obviously with a lot of mentorship from the principal owner, from Dr. Barsley. But beyond that, I hustled, I still hustle. And it's really important to be in a place that appreciates you, and that you have the same philosophy, be it treatment philosophy, general philosophy on stuff, which really has led to my success, because it didn't go against the grain for me, for my personality. It's been a wonderful kind of work environment to be in.
That's so great that it's continued to be positive, and throughout all
For sure.
that change, it still felt like a good fit for you
Mm-hmm.
even today.
Yeah.
What have been one or multiple of the more unexpected things about your journey in dentistry so far? Any bumps in the roads or just surprises that you encountered?
Aside from COVID, which I think was universal for everyone, honestly, it's been a really great path. I think that, for me, just following what felt right. I mean, it might sound corny, but that's what's really been beneficial in my path. Even joining Spear, it just was an organic union, if you will. I was approached, and I felt really great, because I was at the point in my career where I feel like I have enough wisdom to impart, or I've been through a lot of I've been working for a long time, and so I can't really say I've faced many challenges, with the exception of personal challenges. When I was pregnant with my twins, I had to go on bed rest very early, so part of being in a group practice really gave me a lot of relief. So that was good. And then of course COVID, but besides that, thankfully it's been a pretty nice ride so far. So, and diversifying, I think just having a lot of things, like I do, my clinical dentistry, but then teaching at the university, teaching at the hospital to the residents, traveling for work, going to CE. I just keep it interesting. And that to me has maybe that's why I haven't had, any major obstacles, because I change it up a little bit. So I feel very fortunate with that.
Yeah, I'm very similar to you in that way. I like to have a few different
Yeah,
kind of
clearly
buckets
doing this
of life.
podcast thing. Yeah.
Exactly.
Yeah.
Exactly. And I'm sure, honestly, a lot of what you're telling me, I can tell that you just have a very good outlook and mindset on life, and everything you've been talking just exudes a lot of gratitude
Oh,
for
yeah.
your journey and where you're at. And I'm sure that's just come over time in life, kind of working on those skills and mindset and everything. But looking back, maybe some people that are early in their journey might be more so struggling with that, or figuring out what else they want to do outside of clinical practice, or how they want their clinical practice life to look, just kind of figuring out their life vision a little bit more.
Yeah.
Is there any either books, podcasts, or just things you would recommend to people that are in those early stages of their career and just trying to figure things out?
Yeah. I mean, I think, first of all, thank you for your kind words. I think you're perceptive. I do have a very positive outlook in general. And I think the wisdom, if I may, I think I've reached that age where I can impart some wisdom. I didn't know my life would turn out like this professionally. I really didn't. And I think affording myself the opportunity to put myself out there, connect with people, talk to people, find mentorship. So I had great mentors. The head of the Prost department, Dr. Zarb, was one of my mentors. Dr. Barsley, the principal owner of the practice that I joined, was one of my mentors. So finding someone that you can hitch your wagon to, I think, is really great. because it, and both gentlemen, both men were really, really generous with their time. And I think that, for young dentists joining, find someone who you can connect with, not someone that's just looking at the bottom line, someone who's willing to invest in you. Because as I said, I didn't know that my life would turn out this way, my professional life, but I had an open mind and I put myself out there. So things sort of snowballed and evolved. And, and so I think really mentorship is the key for me. I'm not a huge kind of not even self-help, but, big kind of reader. I do love to read, but fiction, not kind of nonfiction. And so for me, it was that personal relationship, having mentors that really helped shape my career. And, this isn't meant to be a plug for women in dentistry, but one of the things that we did was we developed a mentorship program just for that reason, to connect mentees with mentors. So dental students to up to 5-year graduates with mentors, because of that need to perhaps emulate someone who you admire or learn or get some knowledge from them. So I would say keeping an open mind and really opening up, your mind and heart to learn from other people. And podcasts, I love podcasts too, but I love Hidden Brain. That's one of them. Lately I've been listening to Mel Robbins, but she's a little bit drawn out. So I get a bit bored. But yeah, that's what I like to do.
I really do relate to that too. I host a podcast, but I don't even listen to that many podcasts myself. So I definitely relate to that. I like the person-to-person connection. That's why I host one and don't listen. Yeah. I definitely learn a lot from meeting people that are at other times in their dental journey. Absolutely. Yeah, for sure. So before we wrap up, if people want to find out more about the retreat, I'll definitely put the link in the description for this episode. But if for some reason they're not able to travel to the retreat and all of that, if they just want to get involved in women in dentistry, should they just Google it? How would they find out more?
Yeah, our website, womenindentistry.ca. We're on Instagram at Women's Dentistry. So I'm sure we can attach the link, but there's a lot that you can there's no membership fee to get involved. You can become a paid member and you have access to recorded on-demand courses and stuff, but really it's a community. If you want to get on our mailing list, you want to watch our webinars, most of the things are free. And then the Spear event is on our website. It's also on the Spear Instagram page and our Instagram page. We are going to be flooding the market socials and everything with content. So if anyone is listening, we would love to have you join us in Scottsdale. It's great golfing, great shopping, great, sun tanning, and then of course, education and camaraderie, which is really great.
Well, thank you so much for your time tonight. I really enjoyed getting to connect with you and learn a little bit more about your journey in dentistry thus far, which sounds like it's not slowing down anytime soon. So that's wonderful. And I just want to thank you again for your time.
Thank you. Thank you so much for doing this.